So we just finished doing all 4 of those stretches. They were done very gently at end range. And process of doing those, so rearrange your clothing a little bit. And now we match, sorry about that. Okay, so okay, so now we have a match again. I would say that the right ischium is a little more lateral, but I would not call this symmetry. And given that she has asymmetry of the way the pelvis developed in the front, it doesn't surprise me. The question being, did we change movement? And you can see that I can now slowly take up the slack, and that's a much greater excursion before it stops moving. And then when I spring it, it springs forward and it recoils backwards. So we have altered the dynamics of this structure. Same with this one, that's a longer excursion to take up the slack. And now I spring it, it springs forward and it recoils backwards. And I'll now test the other side. Okay, so again we can take at the slack and we can now spring that. And we can now take at the slack and spring that side much more freely. So I'm curious about how this might feel when you're walking and how it might feel when you're sitting. And we may or may not notice a difference, but let's give it a try. Do you want to walk down the hall and back? And then come sit in this chair? Your thoughts?
It feels more balanced than it did before.
Okay, feels more balanced.
Mm-hmm.
Very good. Try sitting.
So usually my lower back around my sacrum feels a little bit achy when I initially sit.
Yes.
But right now it isn't achy at all. I can even just bend forward without any pain.
Very good.
Which is new.
Very good. When I have someone with an asymmetry of their pelvis, I like to look at them in sitting, and I look at the height of the distal femurs. And I notice that this one on the right is a little bit higher, and I notice the femur on the left is a little forward. Now, laying down and standing, you probably have equal leg length. I know in supine you did. I never saw an asymmetry. So, because this femur is longer, and this tibia is longer, the right tibia is longer, and the left femur is longer, so that kind of balances out your leg length. Sometimes taking a small, I call it, this is a soft sacral dowel, sometimes putting that under the trochanter improves sitting comfort because it's matching the shape of your pelvis. It's making you sit the way your pelvis is developed. And in doing so, it looks like the height is improved. Left femur is still longer. What does that feel like?
It feels like there's a little bit of pull in spots there weren't before.
Okay.
But not in a painful way.
Okay.
It's pretty subtle. It doesn't feel like a big change.
Sure.
But it does feel like maybe there's a little bit more circulation.
Okay. So if it's subtle, I'm disinclined to do anything, but I always test the other side, so let's put it under the left and see what you think. For some people it's a very dramatic difference, and for those, then we issue these, but if it's subtle, then we don't. So we now have that foam under the left trochanter.
Yeah, it's even more subtle on this side.
Yes, yeah. So I don't think you need it. But if you do a long road trip, or if you're sitting at your computer for a long time, then maybe roll up a washcloth and put it under your right trochanter.
Okay.
Good. So I thank you for letting us film. This was a presentation on what I name a lower left windswept pelvis. And thanks so much.